Okay, so I'm going to start by knocking on the door, and I'll come in and introduce myself. Hello, my name's Will. I'm a nursing student. I'll be working with you today. Get some hand sanitizer. Can you tell me your name and date of birth? Alright, this is Tom Pillowsworth. Grab some gloves. We're going to be doing a focused assessment today. We're just going to have him laying in bed like we're in the SICU. Alright, Tom. Alright, Mr. Pillowsworth. We're going to be doing a focused assessment. I'm going to start at your head, work my way down to your toes. And I'm just going to be assessing different parts of your body, looking for anything abnormal. Alright, we're going to start with the head. I'll ask him to raise his head up. I can kind of look on the back side, look for any like bed sores, make sure his hair is clean, making sure we've been taking good care of him. Then kind of work our way over to the ears. Just kind of look inside, look for oozing, deformity, or swelling. Check that on both sides. Alright, and then at this point I'll kind of check his eyes. Can you focus on that doorknob for me? I'll put my pin out front. Now look at the pin. His eyes have good accommodation. At this point I usually do check for pupil reaction. Pupils are equal, round, and reactive to light. And then we'll kind of work our way down to his mouth. Alright, Mr. Pillowsworth, can you open your mouth? Have him open his mouth, look inside. And just like to see if he, what kind of condition his teeth are in. Does he have teeth? Is he missing teeth? Does he have a bunch of cavities? That kind of stuff. And then we can also, I can see in the back of his airway, are his tonsils swollen? How's his uvula? Does he have his tonsils? Does he have what kind of lesions in the back of his throat? That kind of stuff. Then we'll have him look up, look at his neck for JVD, tracheal deviation. But his is midline and his jugular veins are flat. We'll check the pulse. His carotid pulses are strong and regular. Okay, Ms. Pillsworth, we're going to pull your gown down a bit and expose your chest. So when I place my stethoscope on your chest, I'm going to need you to take a breath in and out, alright? Start at the top. We'll do apex, medial base, lateral base, lateral base. So we're comparing each side to one another. Alright, Mr. Pillsworth, your lung sounds are clear. They're equal bilaterally, which is really good. So we'll have him lean forward. I can look at his back. Is his back clear? Is it symmetrical? You see any kind of rashes or anything like that? But it's good. I'll run my hand down the spine, making sure that's midline. Okay. So the same exercise. Apex, medial base, lateral base, lateral base. And while we're looking at his chest, is it symmetrical? Is there any kind of bumps or bruising, any lesions? His chest is clear. Now listen to his heart sounds. Listen to the aortic valve, pulmonic valve, tricuspid valve, mitral valve. Alright. We'll work our way down a little bit to his abdomen. We're going to visually assess his abdomen. Is it distended? Is there any discoloration, lumps? I can ask Mr. Pillowsworth, is your abdomen tender? Alright, so we'll listen. We'll listen before we touch here. Alright. We'll say it's the morning, he hasn't eaten breakfast, so his bowel's a little hypoactive. Alright, tell me if you feel any pain or tenderness. Alright, he's soft and non-tender to his abdomen. Now we'll work our way down his arms. Does he have good color going down his arms? Is there any kind of abrasion, skin tears? Like I said, color, lack of color, but everything looks good on the way down. Check his hands, check his radial pulse, it's strong and regular. Does he have any clubbing to his fingers? How do his nail beds look? He has good cap refill. We'll do the other arm. Is his color good on the way down? Don't notice anything on his skin, it's clear. We'll check his radial pulse, it's strong and regular. Does he have any clubbing to his fingers? How do his nail beds look? He has fast cap refill under 2 seconds. Can you squeeze my hand? Alright, his grip strengths are equal. He can follow my commands. Now at this point, it kind of depends. If they can answer questions, I'll probably just ask them if they need to go to the bathroom, if they feel like they've had to go to the bathroom. But if they have a catheter, between their medical history, might have to actually visually look at their genitals, Make sure it's clean. If they can't do it, have we been doing pericare? But it's good. So we'll kind of work our way down on his legs. Checking color, looking for like varicose veins, redness for DVT, but it looks good. Check the tibial pulse, popliteal. Can you feel me touching down here? Can you wiggle your toes? Check cap refill on his toes. They're good. All right. And that'll conclude my assessment.